Both chemotherapy and radiotherapy can cause gonadal dysfunction, which can be either hypothermic pituitary damage or testicular damage. Previous studies demonstrated a significant sertoli cell and Leydig cell dysfunction after cancer treatment during childhood. So, our objective was to evaluate hypothermic pituitary gonadal function of male childhood cancer survivors. To be included in our study, patients have to have either hematologic malignancy, brain tumor, or retinoblastoma, who have been in remission for over a year, and they have to be at least 8 at the time of enrollment. Informed consent was given by all patients or their parents. We excluded the patient who had medications affecting gonadal function and also patients underwent bone marrow transplantation. We conducted gonadotropin-releasing hormone or GnRH test to evaluate gonadotropin response and then classify patients into 4 groups. So the first group was pivotal response, defined as peak LH over 6. The second group was primary testicular insufficiency, with FSH and LH over 30. The third group was gonadotropin deficiency, which had blunt LH and FSH response with low testosterone. The last group was pre-puberty, with a peak LH less than 6. To continue, we perform HCG tests and also semen analysis to identify Leydig cell and sertoli cell function. The results were as follows. There were 61 patients included in this study. Of 61 patients, 28 had hematologic malignancy. Most of them suffered from ALL. 25 patients had brain tumor, and the remaining 8 patients had retinoblastoma. Chemotherapy used in each group of patients are shown in the table. Cranial irradiation were given to some patients in each group with mean dose of approximately 1800 centigrade for hematologic malignancy patients and 3000 in patients with brain tumor and retinoblastoma. Of 28 patients with hematologic malignancy, they were diagnosed at almost 8 years old. Most of them are enrolled at around 17 years old. Most of them had already gone through puberty. All of them were treated with chemotherapy, and about 30% were additionally treated with radiotherapy. This slide shows hypothermic pituitary gonadal function of hematologic malignancy patients tested by GnRH test, which show testicular insufficiency in about 30% of them, and appropriate response for their pivotal stage in the rest of them. HCG tests, which represent Leydig cell function, were normal in almost all patients. However, semen analysis, which reflects sertoli cell function, was abnormal in most of them. Continuing on hematologic malignancy group, 18 patients who were 15 years old were divided into 2 groups according to the GnRH test. Patients who had testicular insufficiency had smaller testicular size compared to those having poor GnRH response. This slide shows normal testosterone response to HCG test, which reflect normal Leydig cell function in these patients. This slide shows the basal and peak FSH after GnRH test were higher in patients with testicular insufficiency. However, peak LH response were indiscriminate in these 2 groups. So in this particular group, we found that the dose of chemotherapy make no difference between testicular insufficiency and appropriate GnRH response patients. Now, moving on to the next group of 25 patients with brain tumors. They were diagnosed at almost 10 years old. They were enrolled at around 15 years old and had been remission for 5 years. Most of them had already gone through puberty. Majority of them received radiotherapy and chemotherapy. Just like hematologic malignancy group, we ran same 3 tests. The NIH test result showed appropriate response to their pubertal stage in 80% of them. 16% have gonadotropin deficiency, and the rest had primary testicular insufficiency. Almost of them had normal Leydig cell function, but abnormal satellite cell function as shown by SCG test and semen analysis. So, in the final group of 8 patients with retinoblastoma, they were diagnosed at almost 3 years old. They were enrolled at around 17 years old. They had been remission for 13 years. All of them had already gone through puberty. Majority of them received both radiotherapy and chemotherapy. We also performed these 3 tests in this group. The NIH test result show primary testicular insufficiency in 60% of them, and the rest had appropriate response to the pivotal stage. SCG tests were abnormal in 60% of them. However, semen analysis, which reflects fertilized cell function, was abnormal in all of them. In SCG test, significantly low testosterone response after SCG was demonstrated in patients with retinoblastoma. To summarize, in this study, patients with hematologic malignancy had significant number of fertilized cell dysfunction but normal Leydig cell function. And patients with retinoblastoma had significant fertilized cell dysfunction with some degree of Leydig cell dysfunction and gonadotropin deficiency. However, in brain tumor group, owing to heterogeneous type of tumor and treatment modalities, patients with brain tumors still need further study. Conclusion: HPG dysfunction occur in many of childhood cancer survivors, and chemotherapy in treating hematologic malignancy had detrimental effect mainly on spermatogenesis. Finally, I would like to thank the Ramathipati Research Grant, Faculty of Medicine, Ramathipati Hospital, Mahidol University. Thank you.